Yesterday, the minister said, while we have the ability to reach up to 50,000 tests per day, it is demand-driven, so it depends on the number of people that actually show up. Speaker, Londoners are showing up, but they are finding it hard to get tests. Arden Urbano needs a COVID test in order to travel for business. Her local pharmacy has designated just 1 hour per day for people without symptoms to call for an appointment. They must wait for a callback up to 48 hours later before they can book a test, often days out. Last week, she emailed me to express her frustration and described the government's testing strategy as a complete fail. Speaker, why is the minister blaming Ontarians for not getting tested instead of accepting her responsibility to meet testing targets?
The parliamentary assistant, member for Eglinton Lawrence.
Thank you, Speaker, and thank the member opposite for the question. As I've said many times, we recognize the importance of testing and testing turnaround times. We've made it clear that testing is a priority for our government, and we've put $1 billion into enhancing our testing strategy. We have a capacity to do 50,000 tests at this time every day. However, we don't always have 50,000 tests to process every day. When we do, those tests are able to be processed, and we're working on improving that number to enhance our testing capacity even further. We're also expecting rapid tests to be approved by Health Canada and perhaps available across the country shortly, and that would be another initiative which would help testing turnaround times. It is possible that occasionally people do have to wait longer for tests, but as I said, 80% of the tests across the province are coming in within 24 to 48 hours, and we think that's a fairly good result, but we want to make it even better. Thank you.
The supplementary question.
Speaker, another constituent emailed me last week to ask why, when testing rates are half the provincial capacity, it took 4 days to get a COVID test appointment at the Oak Ridge Assessment Centre for her symptomatic teenage son. She wonders if confusing messaging and barriers to access testing are reducing numbers, so the government can claim that people are not coming out. And this is exactly what we heard yesterday, Speaker, when the minister said, "I'm not sure if the leader of the official opposition would like us to just go and grab people and bring them in for testing." Speaker, we don't want people to be grabbed. We want a plan for timely testing that meets provincial targets. When will we see it?
Parliamentary assistant.
Thank you, Speaker. We do have a plan for timely testing that meets provincial targets. We're doing that plan. We're executing that plan right now. We are meeting our targets. We're able to test and process 50,000 tests a day at this time, and we're increasing that number every day. As to the member's suggestion that you cannot get an appointment for testing, I can't speak to the particular testing centre that you referred to, but I do know that within the City of Toronto, when I have gone on the websites of the various testing centres, I've been able to get an appointment within an hour. So there are many testing facilities available, and we have 160 assessment sites set up around the province. There are lots of testing sites available, and I hope that people will be able to get the tests and get the results as quickly as possible. That's certainly what our plan is working toward. Thank you.